Tamara White, Director of Nursing, Health Services Incorporated.
All right. Ms. White, thank you so much for giving us a little bit of your time today. We really appreciate it, and we appreciate the partnership that we have with Health Services Incorporated, and also the fact that you've been extremely helpful in helping us connect with appropriate individuals in the organization.
You're welcome.
Can you tell us a little bit about some of the initiatives that you've been working on? I know that Mr. Darrington was talking about some of the things that the overall organization is working on, but can you tell us a little bit about some of the things that you've been focused on? And I know that it may be on hold a little bit because of COVID, but what are some things that you've been doing recently to either provide more services for patients or expand services or things like that?
Okay. Right now, during the COVID pandemic, we are really doing our COVID drive-through testing that is located here at our Montgomery area at our wellness center. So right now, we're operating on 2 days a week, Mondays and Thursdays, from 8:30 to 3 o'clock. That patients that just need to be swabbed, they don't have to wait. They can call our hotline, be put on a schedule, and we accommodate those patients that way. But if they are symptomatic, we do have them to come into the clinic, not wait in the lobby, but be serviced by a provider within the room.
Okay. And Mr. Darrington had said that one of the biggest challenges that y'all face as an organization is staffing, particularly registration clerks and potentially nurses, and then patient care techs and things like that. Can you talk a little bit about that, and maybe how you potentially see that could be, you know, how you're working on that to improve that?
With our clinical staff, when the pandemic occurred, school was closed, so they went to virtual learning. And with that being said, some of our staff members had to, you know, take a leave to stay at home to care for their children and families. And some of their family members became sick with COVID. So during that time, we did have to compile some of our services. We also had to close only one clinic, but we used that staff in other clinics to help where we had a decrease in staffing. With that being said, some staff did, after school reopened, we did have some to return back to work, and that kind of helped with our staffing need. But one great organization that we reached out to was Fortis College. We have been doing interviews with them to kind of accommodate our staffing need with medical assistants. Within our organization, we have medical assistants, we have licensed practical nurses, and also we have registered nurses that helps in our clinical area along with our providers. So we do reach out to partnering colleges within our area to see if they have a need of students that are in look of a job. So we're looking for medical assistants and LPN or RN nursing staff.
Okay. Do you see that? Because you know, we live in Birmingham, and I think across the board, it's a struggle for every healthcare organization to find proper staff that's been trained and things like that. So do you see that as a continuing need down the road for y'all as well? And is there a need for that to potentially be expanded in the area as far as educational opportunities for them so that they can enter into a career potentially in healthcare?
Yes, it's a continued need for nurses in our area. Recently, you know, there has been a high volume of nurses retiring, so we do have to try to replenish the staff that we have. This is a competitive environment that we're in now because we are located with 3 hospitals and multiple clinics in our area. So we are in an area where we are having limited resources with, you know, hiring staff, and we have an abundance of, you know, clinics that they're in the same need that we are in right now to hire staff, get them trained, and be able to take care of patients effectively.
Okay. Your organization provides lots of great care across many counties to patients that really need it. What are you excited about the future for Health Services Incorporated? What do you see that really gets you excited about the future and what y'all can be able to offer and things like that?
Some of the things I'm excited about, really going in other counties, like expanding to Prattville. Right now, I'm excited about, different initiatives like in our Hayneville area. We have our clinic there, but we know that community is also looking for us to expand our services into later in the evenings or even on weekends, so we can help serve that community better. So I'm looking forward to those expansion in our hours and having availability to our patients on the weekend.
Okay. Do you see the buses, I know that one of the buses is going to be specific to
Yes.
COVID right now, but the other bus potentially being a key part of that, going to other counties and things like that?
Right. We're looking forward to that because before COVID, we did service our community, that we went to different locations throughout the week, especially servicing our homeless patients, making sure they had adequate care. So I'm looking for us to get back into some of our normal routine with that, and making sure that we're out where we're needed within the community.
Okay, okay. Well, that's all the questions I have for you. I really appreciate, again, your help in helping us connect with the clinics that needed the supplies. And as I told Mr. Darrington earlier, I'm hoping that we can make this a long-term partnership where we help y'all with either specific equipment needs or supply needs or things like that down the road, or if you're opening up a new clinic, we can help you with some items there too. So I just want to
I appreciate that. Thank you.
So
Thank you so much.
you are so welcome.